Good morning, everyone, or good afternoon. Welcome to our second conversation, our COVID conversation in our COVID and equity series. This is a 5-part conversation series in which we are examining the relationship between the COVID-19 pandemic and health equity. And our hope is to equip you that are joining us today with an understanding of the key ingredients and approaches to implementing and sustaining change that prioritizes equity for all. And I know you join me in that goal. My name is Claire Betker, and I'm the Scientific Director of the National Collaborating Center for Determinants of Health. And we are one of 6 national collaborating centers for public health that are located across Canada and that are funded by the Public Health Agency of Canada. And I'm pleased that we are hosting these equity conversations in partnership with the Public Health Agency of Canada. The National Collaborating Center for Determinants of Health is located in Mi'kma'ki, which is the unceded territory of the Mi'kmaq people. The center is hosted by St. Francis Xavier University in Antigonish, Nova Scotia. I'm joining you today from Winnipeg, Manitoba, which is in Treaty 1 territory, the original land of the Anishinaabe, the Cree, the Oji-Cree, the Dakota, and the Dene people, and the homeland of the Métis Nation. And I want to respectfully acknowledge that we all live and work in the traditional lands of the many Indigenous peoples across Canada. So to start, a few housekeeping items. I'm really excited about this conversation, embedding equity in pandemic planning, response, and recovery. We've got 3 super guests with us, experts and energetic speakers. So I'm really looking forward to the conversation. So as I said earlier, our conversation these conversations, are our second series of COVID conversations, and we have planned for 3 more after this one. We're having 5. They'll all be held on Wednesdays at 12 noon Eastern Time and are scheduled for every other week. So that means our next one is on March the 10th. Our conversation today will be recorded and shared with registrants, those of you that are with us, and there's more than 100 of you with us right now, via email. And it'll also be posted on our website for future reference and for those who are unable to attend today, or perhaps for your use with your teams if you would like to bring that recording with you to a team conversation. And it should be posted by the end of the week. Please use the chat box. You'll see down at the bottom there's a chat box for conversation and connection with one another. And you can start right now by introducing yourselves, where you're from, connecting with others. Use that chat box as part of your conversation. The members of our NCCDH team, we have Danielle McDonald, Jamie Steef, and Claire O'Gorman with us from our team at the NCCDH. They'll be adding resources to that chat box as we go along, so you can watch for those there. But also feel very free to share your own resources in that chat box if you'd like. We would welcome that. One of the things that we are hoping over this this particular series, is to gather stories and gather ideas about what's working out there in terms of embedding equity in your pandemic planning, your response and recovery. So please use that chat box to either reach out to us or to put your story in there, or suggest someone that we might want to connect with. And 2 weeks ago, we had a number of ideas, and we have since reached out to those folks and are really very happy to hear their stories and to start to build a bit of a repository of what's working out there. Use that chat box also for questions. This is a conversation. We met last Friday, the speakers and our team. And so we have a couple of questions to start off the conversation that we've crafted and that they're prepared to speak to. And they came actually from last time's conversation and the registration. But please feel free to ask your question and ask it in either French or English, and we'll answer as many of the questions as we can today. But if time does not permit, and I anticipate that, we'll make sure to get the answers to you, or perhaps use them to inform the next 3 conversations. As I said earlier, this is the second series of COVID conversations that we've hosted. The first series, interestingly enough, included 5 conversations on the 5 Wednesdays in April of 2020. And the focus then was on what needed to be considered in terms of equity as people and organizations, and really all of us around the world were actually planning and moving into that response. And who knew that actually almost a year later, here we are still in the middle of the COVID-19 pandemic response. Those recordings of those 5 conversations are available on our website. They're a very interesting series. We had 13 speakers. Some of those speakers we've invited back to this series from a broad range of public health and community organizations and therefore perspectives. And I find it very interesting as to how right on those speakers were in April in terms of where we are today. So if you want to, please go and visit those conversations. We've also done a thematic analysis, and we'll do it again with these conversations. And there's actually an article in press that we'll share on our website. So I'm going to ask Danielle to put up a Wordle. And at the very end of our conversation, and I'm going to ask you again this week to do it as well, or in this conversation as well, we asked you to put into the chat box one word that was sort of sitting with you or in your mind as you left the 1-hour conversation with us last time. And you can see that those words there reflected in the Wordle, and certainly equity, that's good. That's what we're here to talk about. But what I found really interesting are the large words around it. So intersectoral collaboration, trust, action, engaged, engagement, team. Some of you felt hope, that building of that intersectional and intersectoral perspective. I thought interesting over on the left-hand side there, where we were looking at both health, but also social. So not only thinking about embedding equity from a health perspective, but also within our social services and our community partners. There were a few comments, I think, that gave us some pause, that perhaps we were talking at a level that, you know, is not applicable, not able to sort of ground it in your everyday practice. So I'm really hoping that, and I invite our guests today to really think about how that translates on the ground to public health practitioners and to our community partners and our social services partners. And we really heard about community engagement. So, and so did our guest last week, or 2 weeks ago, Dr. Theresa Tam, the Chief Public Health Officer, and Dr. Stephen Hoffman, who's the CEO of the Canadian Institute of Health Research, and many other hats that he wears. So today we'll start by hearing from our panelists about how they've used actually the practice of community engagement, or engaging community and community members, to inform their COVID-19 response in their communities or in their organizations, with a very particular focus on how that would work to embed equity in their response. The questions that I'm going to pose are guided by those that you provided in registration, some of your comments from the last time we were together. And as I said earlier, we will have time for your questions. So make sure that you pop them into the chat box, and Claire, Danielle, and Jamie will be monitoring that and will help me with some of that questions after our first set of kind of comments. Just as a bit of information for you, from our registration, we know that about 60% of you are from Ontario, which doesn't really surprise us. And interestingly, all 3 of our speakers are situated in Ontario. Almost half of you, about 47%, are working in public health at a local, regional or national level. And we're really pleased to see you here today. And I really would like to extend our thanks, our collective thanks for all your work over the past year that you've done on our behalf. So thank you for what you've done and what you continue to do. For those of you that are working in those public health organizations, I know it's been a heavy lift, and I really appreciate, or we really appreciate your efforts. So I'm just going to say just a very brief introduction, because I've asked each of the speakers to give a more broad introduction and kind of situate what they have to say and share with you today. But just very quickly, Dr. Smita Pakale is with us. She can give a wave there, Smita. She's a clinical scientist at the Ottawa Hospital and the Ottawa Hospital Research Institute, and also at the University of Ottawa. And she's leading community-based research projects, one of them actually funded by the Canadian Institute of Health Research. So sort of drawing that those perspectives from Dr. Hoffman, Stephen Hoffman last week, right down at that community level. And those projects are at the Bridge Engagement Center in Ottawa. Dr. Kate Mulligan is an assistant professor at the Dalla Lana School of Public Health. She's the Director of Policy and Communications at the Alliance for Healthier Communities, and she's a member of the Toronto Board of Health. And it's really from that perspective we've asked Kate, and Kate's a favorite speaker for us and a favorite guest, and has done a lot of, I'd call her a friend of the NCCDH, she's done a lot of work with us and on our behalf, and we really appreciate our partnership with Kate. And finally, Bonnie Hostrasser. She's the director in the Office of the Chief Public Health Officer of Canada that's for Dr. Theresa Tam, within the Public Health Agency of Canada. And we've asked Bonnie to give us that perspective on the role of the report, the annual report from the Chief Public Health Officer of Canada, and a bit about her vision on the way forward, and how that report, and direct you back to the one that was released in October, that really I think very well articulates the necessity for using an equity approach to COVID-19 pandemic. So I'm going to proceed to our questions, and I'm going to ask Smita, Kate, and Bonnie to respond, and I'll kind of speak in between. But these are the questions. So based on your experience, how have you, or how do you bring the voices from community into your work and into that COVID response that we're smack dab in the center of right now? And why do you believe that community engagement approach is so important to embedding health equity into COVID-19 planning, response, and recovery?